Okay, so we're going to pretend like my leg is elevated because we're working on swelling, right? And so I have 4 pads. I'm going to go channel 1, and this is where we talked about the colors of the pads are kind of handy sometimes. So my swelling is all in the knee, so we know with interferential it's going to cross over. So on my first pads, there goes that, are going to go here and here. And we can separate that out a little bit to make it so that they're, okay? So this one, the direction of the current is going to go from here over to here. If I was just doing like a pre-mod, but because we're going to do interferential and we're going to do sweep, so now my red one's going to be the other channel, channel 2. Helps to have nails, which I do not have. So that's going to be right there, and I kind of get that so that you don't have to tweak the lead wires. This one's going to go here. So now you can see that with the sweep, it's going to sweep around all this whole area here and help with that swelling. Okay? So now we're going to go ahead and reset it to interferential. And we have everything set. We have the time for 20 minutes. We're going to do a low rate of 0 to 10 pulses per second. We're going to do a sweep. And now I'm going to turn it on and tell my patient to tell me when they feel it. So I'm starting to feel the tingles. And now I'm going to ask him just to get a nice little comfortable contraction. And so now I can feel it pumping. About like that. I'm going to go a little higher just so you guys can see it pump. And then I'm going to hit start. And then it's going to pump for me. And you can see it starting to pump in there to help, and I'll try and go up a little bit higher. There we go. So I can turn that up a little bit more so you guys can really see it. And it's going to pump. Okay. So that's probably a little bit more than I want because I'm starting to get a little bit of inversion, so I'm getting my posterior tib a little bit because this pad's a little bit big. So I don't know if you can move that camera down a little bit so they can see how it's making my foot go into inversion. And that's not voluntary, that's the machine doing it. It's taking me into a little bit of inversion. So I would probably move this a little bit if I'm just wanting to get a pumping action of my knee. I could either turn it down a little bit, or I could rearrange that pad a little bit, probably use a little smaller pad so it doesn't get that part of my knee. Okay? And then I could have my patient be doing some active pumping along with the machine to help with that swelling. Okay? There we go. And then we'll turn it off when it's done. Again, I'm giving them that bell. I'm going to check with them in 5 minutes. Sometimes they accommodate, so we turn it up a little bit more again. And then when they're all done, we turn it off. Put those pads back on their little stickies. And each patient has their own pads and they have their names on them, so you don't cross-contaminate. You always want to make sure you clean the skin ahead of time. And then when we're all done, we check their skin to make sure there isn't any adverse blisters, burns, redness, uncomfortableness. Oftentimes you'll finish up with some ice. Okay, so we check the skin, we have them move it around a little bit, and then we would, what I did forget to mention was you usually do the girth measurement ahead of time to see how much swelling is there compared to the other side, and then when you're done you're going to recompare this side to see if you made a difference and you had less swelling. Okay, that's it. Thanks.